Welcome to your CT Style Express. I'm Natasha Lubchenko. In your health update today, bowel incontinence affects more than 20% of adults, but is often not talked about. Our guest today wants to open up communication on the topic and says there are treatments available. Dr. J. Michael Parker is a colorectal surgeon at Middlesex Health. Doctor, thanks for joining us today.
Thanks for having me.
So let's just first start with this for those who might not be familiar with this topic. What is bowel incontinence?
Bowel incontinence is the difficulty that affects many people where they have trouble controlling their bowel movements, controlling the stool. There are people who also have urinary incontinence, and they can be the same people, but sometimes it's just bowel. And it can be people who have had issues with pregnancy. It can be people who have had surgical issues, radiation for anal cancer, rectal cancer surgery. There are quite a few that are affected.
So a decent number of people are affected by this. It seems like it's a topic not many people talk about, though.
Correct. It is certainly something that has to be either brought up by somebody like me or a primary care doctor. And some people just research the subject and find opportunities for help.
Now, what treatments are available at Middlesex Health, ranging from, the least invasive, but I know you have a range of treatments.
Sure. So basically, the first thing we try to do is figure out what the causes are. Are there any things that we can correct? So obviously improving the quality of the stool where it becomes a little bulkier, more easy to sense and manage is always helpful. Diarrhea is difficult for everybody, no matter what. So we try to improve that, and then we focus on pelvic muscle strengthening. We have testing where we can test the anus and rectum for sensation and strength. We have a pelvic floor therapy program, which is very effective. And then there are some surgical treatments, including bulking the sphincter, but I focus more on sacral nerve stimulation because I think it's best to try to improve the sphincter you have.
Now, let's talk about that, that last treatment right there. How long would a procedure like that take?
So basically, it's a two-part procedure. In the first part, you're implanting a wire which helps stimulate the nerves gently to improve communication between the bowel bladder and brain. And we do that as a trial period. So you get a few weeks to see if it works for you. If it does, then we can move on to a more permanent implant. And if it doesn't work, we can always remove it. So it starts with a trial phase, which takes about 45 minutes to an hour. And then the implant phase is even faster.
So is there really any downtime here?
No downtime. It's an outpatient procedure with a little bit of anesthesia, and you go home the same day, and you can get right back to activities. And the therapy should start working immediately.
It's nice to know that people have multiple options with you at Middlesex Health. And where can our viewers go to learn more if they think this might benefit them?
The best thing to do is go to our website, www.middlesexhealth.org. We have a pelvic continence center, and there's lots of information for all patients regarding bowel and bladder therapy, and I'd be happy to meet with them at any point and answer questions.
Wonderful. Dr. J. Michael Parker from Middlesex Health, thank you so much for your time today and for the important information.
Thanks for the opportunity. Have a good day.
And that is it for today's CT Style Express. I'm Natasha Lubchenko. Thanks so much for watching. We'll see you right back here tomorrow.